they need to put in place, or people that they care about, some help they need in the community. Jim, what would you like to share with us in Baldwinsville to kind of give us an idea of what's going on with you guys?
Yes, hi. Again, my name is Jim Hogan. I'm the director with the Greater Baldwinsville Ambulance. Just to let you know where we cover. So we cover the Greater Baldwinsville area, just like our name. It's the village of Baldwinsville, the town of Lysander, the town of Van Buren, and a section of the town of Geddes and Camillus. So we're the ambulance for the area. First, I want to thank the public for really supporting us during this pandemic. We've received a bunch of donations. The Lock One Distillery has donated to us liquid hand sanitizer. So as everybody knows, that's an important item today. And then we've had the sewing community has been very helpful. We've had people form groups that have actually made for us, the face masks.
Yeah, nice.
That's been very helpful because all of this stuff we're using much more than we've ever used before. So I first want to thank the public for doing that. That's it's really appreciated. And the other thing that for the public to realize that this is very trying times, obviously, for both the public and the ambulance corps. A lot of our members, they have a lot of anxiety because they feel if they go on a call, this could be the call that they could catch the disease. So we've been doing a lot of coaching, and our staff has been doing a great job of, protecting themselves with the PPEs, the personal protective equipment. And so it's a little intimidating for everybody. The key thing for the public to realize is try not to call for the ambulance unless it's a real emergency. And historically, we do a lot of calls that are not emergencies. So that's what we do. We take care of just about everything, but a lot of times it's not an emergency. But what the health department would like everybody to realize in the community is if you have a fever, a cough, maybe mild trouble breathing, first contact your primary care provider. Contact your doctor and have a conversation with them and get advice from your primary care provider. If for some reason you do not have a primary care provider, we have these little cards that we're giving out. Upstate has created a local hotline. Upstate Medical University has a hotline, and the hotline number is 3979. Again, it's 315-464-3979. And this is for people who do not have a primary care provider, and Upstate will kind of assess them over the phone and give them advice that maybe they should call 911 or they should go to the emergency room. And but the key thing is kind of in these pandemic times, you don't really want to go to the hospital unless you have to.
Yeah. Because obviously if you go to the hospital right now, there's a better chance of catching something like this because people are going in there that have the COVID-19, unfortunately. So
correct. So we're saying, we're not saying don't call 911, but try to do your best to make it so that it get advice first and then call. But I just want to make sure I'm very careful saying, if you're having severe trouble breathing, you're having bad chest pains, you've fallen, can't get up, call 911, obviously. Yeah. And it's going to be a little different when we do come because we're instructed by the health department, to wear all the PPE, and we really don't want to go inside your home if we don't have to, because again, that's where we can get exposed inside a closed environment. We're going to ask you to come outside if you can. Obviously, if you can't, we're going to come in, and we're going to have the protective equipment on. Um, we're actually gonna assess you from a 6 feet away, asking the real obvious questions. Do you have a fever? Do you feel like you have a fever? Do you have a sore throat or cough? Are you short of breath? We're trying to find all this information out, and then we're going to take care of you. But it's a little bit of different procedure.
Right. And obviously, like you said, if someone has fallen, you'll go in to help them. If there's something, it's an emergency, you can assess it. That hasn't changed. It's just if they're able to come outside and have a conversation with you.
Right. It's just in a better environment, and then we'll get you in our ambulance. And we're still doing everything that we normally do with our advanced life support equipment, the paramedics and EMTs. It's all about protecting the public and protecting us, and at the same time, providing very good care.
Right. Now you have a much larger area to take care of than I ever realized when you were naming the location. So that's a lot of people to take care of. If it's not a true emergency, calling 911 will probably get them a little bit of the information they need and then direct to you. But that is you guys do a great job. That's a large area.
Yeah, it's about 45 to 50,000 people.
Wow.
And then we're at the ambulances now. We assumed all responsibility. We're the first responder that's going to be coming, and the police and fire department will help us if needed. But we're trying to limit how many people get potentially exposed.
Right.
So our gals and guys are in. We're first. Yeah. We're first responders.
And Chief Leffencheck had made mention of that too. I believe last Monday when I talked with him, that they will come if it's a true emergency where their assistance is needed. But if it's something like like if it's the fall where they need help up, or an evaluation of, like you talked about being outside. But he had said that as well. It's really you guys going out there for the first line, and if need be, the police will come as well.
Right. Yeah, we have a great relationship with the Baldwinsville Police Department. We're just, again, trying to limit how many people potentially get exposed. And that's all guidance from the health department. And it's a different, it's a different process for us. We're used to having, we always want to protect ourselves before, but this is a very heightened level now. Limit the number of providers that are in contact with the patient, and it's also to protect the patient too.
Oh, right. Yeah, that makes sense. Is there anything else that's changed or a little bit different that you guys are doing, or something you want to mention to the public?
That's pretty much our process now. We are getting low because we're cleaning and cleaning and cleaning. We are getting low on general cleaning products that like clean surfaces. Mm-hmm. So if anybody can help us with that, we have our normal suppliers, but as we all know, it's just really difficult to get anything related to cleaning and protective equipment. So if anybody out there has some extra cleaning solution, especially for cleaning surfaces, come knock on our door.
Yeah. Okay, so like Lysol, Clorox wipes, things like that, you guys are looking for?
Yeah, okay. It's really difficult to get for everybody, but especially for us.
No, that makes sense. And I know you said that right now you're not short on the masks because people have made the donations, but like you said earlier when we were talking, we don't know how long this is going to go on for. So that's something I'm sure that you want to keep having them come in.
Right. Yeah, that's because right now, our call volume, we're able to handle everything, and our supplies are we have enough, but I definitely want to make the public aware of that, not to stop making masks. We'll take the masks, and because I think the next few weeks in the greater Syracuse area, our volume could increase, and as more people get tested and people who have been exposed that do come down with COVID-19, their symptoms may get worse. So we may get real busy. Hopefully not. But we'll keep bringing us the supplies.
No, that's it's great. And like you said, our community is amazing at providing for other people in the community. I know woman Cheryl is in our community. She started working with 2 other people making masks. I've seen other groups of moms who sew, and they're happy to do it because, you know, the other things that they're normally doing, we're all living a different normal. So them being able to contribute is amazing. And I'm thrilled with the cleaning supplies now too, just because Baldwinsville has just been so generous with pretty much everything people have asked for.
Yes, they always have been, and they're even more so now. And upstate, this is a mask. If I can position it so people can see, this type of a mask is a mask that it simulates an N95 mask, and this pattern is on University Hospital Upstate's website. So there's actually instructions on how to make a mask that is appropriate and protective. So it's on Upstate's website. If somebody's going to take the time to do it, we greatly appreciate. They probably should go to that site. That way they make a mask that's appropriate.
Right. And they definitely would, like you said, would want to. The last thing you want to do is spend all that time making something that's not going to actually help the person who's wearing it, or people not know that it's not the right type of mask and wear it, and it's not doing the protection that it could be doing. So.
Then we've had people make these are similar to the like a regular surgical mask. This type of mask, these are greatly appreciated also. But the mask that's shaped like the N95 is the best type.
For you.
It provides the most coverage and the most protection.
Okay. And I'll be sure to add that to the post. You said it's located on Upstate's website, the directions to get.
Yeah. They have a section about COVID-19, and there's a lot of educational material, but there's a section on there about people that are making masks, and they have really, I think it's a pattern that is on there.
Okay. Yeah, I'll definitely share that. So, well, thank you, Jim, for talking with me today and getting this information out to everyone. It's certainly appreciated, you guys being the first responders, still going out there and helping people, whether it's COVID-19 or just our normal reasons that we have the ambulance service. So,
you're very welcome. And again, I really wanted to say a big shout out to the public for supporting us. We greatly appreciate it.
Awesome. And that's great to hear. And I don't know who couldn't love Baldwinsville at this point. We're doing an amazing job getting everybody safe and everybody supplies. So enjoy the rest of your day. And I may reach out to try and touch base with you again if this continues for too long, because it is important that people know what you're doing and how we can help you keep doing what you're doing. Okay.
Sounds good. All right. Thank you.
Sure. Bye, Jim.
Bye now.